Britain's National Healthcare Service, they say, is short-staffed, about 60,000 employees, and those MPs say it's a huge risk to patient safety. Let's bring in Abhi Kugadasan, who is in London this morning with the latest on the state of the NHS and its future. Tell us more, Abhi, about what is in this new MP report.
Heather, this report sounding the alarm on the public healthcare system here, saying that the staffing issue is a massive crisis that's just going to get worse. Let's have a look at some of those numbers. We're talking 60,000 unfilled medical professional jobs at the moment. That includes over 12,000 doctors who should be working in hospitals, and they're short 50,000 nurses. Medical professionals are also leaving their posts. More than 500 midwives left their jobs between March of last year and March of this year, and a lot of that has to do with the pandemic. They're overworked, they're exhausted, they're burnt out, and they could no longer stay in their jobs. And the chief executive of the NHS employer spoke earlier this morning, and he said staffing is the solution to this problem. Let's have a listen.
We are living longer, we are getting sicker, we need more care. And that care doesn't happen by itself. We are fundamentally a business that is made of people, and we have to have a plan that speaks to all the people.
And the pandemic has created another problem too, a backlog of patients. More than 6 million people are on wait lists for elective surgeries. That can include anything from heart surgeries to gynecological procedures, and they weren't able to get that during the pandemic because they were not considered emergencies. They were crucial for this person's health, but not considered an emergency. So again, the numbers very dire here this morning. This report is out. It's been put together by MPs from across the political spectrum, and the agreement and the sense that they have here is that the government needs to prioritize this immediately, Heather.
So the task of tackling that issue and of prioritizing it, Abhi, will fall on the new Prime Minister. So what have the two candidates been saying, Rishi Sunak and Liz Truss?
Well, Rishi Sunak and Liz Truss know that the NHS is a matter of pride here, and they know that no matter who ends up in 10 Downing Street, they're going to have a look at this issue. Rishi Sunak, for his part, has said that this backlog, he's called it the greatest public services emergency. He, as Chancellor, was the one that raised the national insurance tax, and he's going to look to drive home the fact that Liz Truss will cut that tax and that would hurt the NHS. Liz Truss, for her part, is centering the focus around the NHS on Brexit. She has said that she's going to have a look at some of the EU laws and potentially scrapping some of them that she feels hinder UK growth, because that growth is what will help fund the NHS. We're going to hear more specifics surely today when the two go head-to-head for the first time in a debate tonight. This will certainly be a question given that this report came out this morning, so we'll hear more specifics. But right now, the messaging from both camps is that their candidate is the person to right this ship.
Abhi, thank you so much. There's Abhi Kugadasan in London today.